Hello, good evening. Welcome to FeM Surgery What's Up Doc series. This is the second installment. My name is Dr. Peng Keng Xiang. I'm a urologist with FeM Surgery. Thank you very much. Shout out to William, who is with us now. Also, a big shout out to the Singapore Cancer Society, who is supporting us in this event and also in our first installment. So this is part of our collaboration with Singapore Cancer Society to raise awareness of the more common cancers in Singapore. So today we are going straight to prostate cancer. Hopefully at the end of today, we'll give you a better understanding of prostate cancer and raise awareness of this common cancer in Singapore for men. Okay, let's jump straight in. So once again, for those who have just joined in, my name is Dr. Peng. I'm a urologist with FeM Surgery. Today we are going to talk about prostate cancer. So let's see where this prostate gland is. So for many men, this gland is actually not very well known. It's actually a reproductive organ. Its main function is to produce semen fluid during ejaculation. As the man grows older, it enlarges as the man ages and leads to urinary problems, urinary symptoms. Unfortunately, it also leads to prostate cancer. So let's have some cancer statistics, how common it is. It's actually the most common cancer in men in the Western world, in the US and in Europe. Fortunately, in Asian countries, it's still not as common. However, it's definitely increasing in incidence and is believed to be related to Western lifestyle, in particular westernized diet. In Singapore, it has reached the number 3 position in men, second only to colorectal and lung cancer, among the top 10 cancers in Singapore. This is a chart showing that it has steadily increased over the years. You can see when we were in the 70s, when we were not so affluent, our society was not so rich, perhaps the Western diet was not so common. It was in a lower incidence. As over the years progress, this cancer has increased in incidence steadily and is still rising. Next, you'll see that about 1 in 16 men in Singapore in his lifetime will contract prostate cancer. That's quite high. That's more than 10%. And this chance of getting prostate cancer increases as the man grows older. And you can see from the curve, it starts to increase when the man hits 50 years old. So what are the risk factors for prostate cancer? I'll just name a few on this slide. Definitely, if you have a father or your brother, what we call the first-degree male relative who had prostate cancer, you have 2 times higher likelihood of catching prostate cancer as compared to the general population. And recently, this has been found to be due to some inheritable causes. More certainly, we know now that certain tumor-related genes such as BRCA1, BRCA2 genes are related to prostate cancer, and these can account for the inheritable cases of prostate cancer. As mentioned, age itself is a risk factor. As a man grows older, the chance of getting prostate cancer gets higher, and this risk increases when the man crosses 50 years old. Obesity is also found to be associated with prostate cancer, and this is probably related, as I mentioned just now, a more westernized diet, especially those diets that contain a lot of processed foods, a lot of food cooked in high heats, like barbecue food or grilling. All these may result in prostate cancer. So thanks to Jonathan for logged in. Please share this link with your loved ones or men in your family who may be in the affected age group, do share with them this link and let them find out more about prostate cancer tonight. Okay, so is there any way to detect that you may have prostate cancer? So what are the symptoms of prostate cancer? So as I showed just now in the diagram, the prostate is actually below the bladder where the urine passes through. As you may imagine, then most of the symptoms of prostate cancer are related to got to do with the urination. For example, you may have a difficulty passing urine, the flow comes out quite slow, or you may have to pee quite often, having go to visit the toilet more often, for example, every hour, every 2 hours. In the later stages, you may even have blood passing out from your urine, passing out frank blood itself. Sometimes men with prostate cancer may not have any of these symptoms. In fact, a lot of patients with prostate cancer are detected when they are in the asymptomatic stage. Therefore, when you reach the affected age group, especially more than 50 years old, perhaps you should consider getting yourself tested for prostate cancer. Okay, so as you know, most cancers go through different stages. And not surprisingly, the earlier the stage the cancer is, the better the survival, the better chance of recovery for the patient. So when you are detected in a stage 1 or stage 2 of prostate cancer, your chance of survival is very high, in excess of 90%, as compared to when you are detected at stage 4, the survival is gone down to 38%. Hi Shirley, thanks for logging in. So let's compare this cancer stage with regards to where are the men detected in Singapore? At what stage are they diagnosed? So unfortunately, as you can see, in stage 4, almost 1/3 of patients are detected at the late stage. So fortunately, most with more awareness, almost 50% are detected in the stage 1 and stage 2. So through campaigns like these with the Singapore Cancer Society and like tonight's session, we are trying to hope more men can be diagnosed when they are at stage 1 and stage 2 and not wait until they are at stage 4 for the disease to be diagnosed, because the survival will be poorer at the later stages. Hi Gregory, thanks for supporting us in this campaign. So, all right, so with regards to the symptoms I mentioned just now, you will see that I'm trying to show you that the symptoms sometimes do not occur at the early stage as we all hope, and they tend to occur later. The reason is because as the cancer grows, they only cause symptoms when it starts to obstruct the urinary flow. And unfortunately, by then, they have grown to such a size that they may be in the later stages of the disease. Conversely, when they are in the early stage of the disease, the tumor is still very small. They may not cause any symptoms. Therefore, most of the men whom we saw when they are detected early, they are still in the asymptomatic stage, and they've actually come forward to get themselves tested for prostate cancer before they have any urinary symptoms. Oh, hi, Olivia. Thanks for logging in. You have a question. Let me take this question later at the end of the talk. But keep the questions coming in, everybody. It's good to see a lot of responses. All right, let's go to the main crux of today's talk, which how do we get detected early? What is early detection? So let's see. So early detection for prostate cancer is actually very easy. We have two main things. Firstly, a simple blood test. This blood test tests for the prostate cancer marker. We call it the prostate specific antigen. It's called a PSA for short. It's produced by the prostate cells, and in men with prostate cancer, the level of PSA is higher in the blood than in men without prostate cancer. For tumors that have grown to a certain stage, they may be can be felt with a physical examination, and we can actually feel a hard nodule when we examine this man. So this diagram is talking about PSA testing. Let's say we test 100 men. Okay, you can see the row on top, maybe 20% or 25% of these men will have a high PSA. Okay, but actually of these 20 to 25%, only 1/5 of these, or 1/4 of these, those men in red, marked red, will have prostate cancer. Why is this so? Because actually several other causes also lead to a high PSA. For example, large prostate size, prostate infection, things like that. However, we would recommend all men with high PSA, with a higher than normal PSA value, to undergo biopsy to test for prostate cancer. So you may say that then there will be a lot of men who have high PSA but actually do not have prostate cancer. Absolutely. So what we do now is we try to improve our accuracy of diagnosis. We have a few tricks these days. Fortunately, MRI has become very advanced. As you can see on the bottom right picture, in the sea of black, sometimes you may see a bright spot in the prostate gland, and this bright spot actually indicates prostate cancer. This is what the radiologists call restricted diffusion weighted imaging, where the prostate cancer lights up more brightly than the rest of the prostate. This is another diagram. You can see the prostate is marked in the purple line that marks the entire prostate gland. In this case, this patient had a few suspicious areas, and we've marked them out separately. We call them regions of interest, or ROI. So each region of interest indicates a suspicious area which we think may be prostate cancer, and therefore we would target these areas for biopsy. So how is biopsy done? So you can be actually done through two methods: through the skin, what we call transperineal, or through the rectum, transrectally. And we put in a needle and we pick up the cancer cells and send it for pathological testing. So this is what we call a robotic-assisted prostate biopsy, where we use the latest technology, where we fuse the MRI, which you saw just now, with ultrasound images, and we precisely localize where the suspicious areas, which we pointed out just now. In this diagram on the left, you can see the suspicious areas are marked out in green, whereas the whole prostate in pink. And therefore, we can put a needle exactly where the suspicious areas are. And also at the same time, we can sample the rest of the prostate, and therefore adequately get a good biopsy of the entire prostate to find out where the prostate cancer is. So thank you for logging in, everyone. Do keep the questions coming in, and we'll address them later. Share the link right now if you are online with us, and hopefully more people can get in touch with us and learn more about prostate cancer this evening. So next, I will quickly touch on the few treatment modalities for prostate cancer. In some prostate cancers, actually, you do not need to do anything. This is what we call low-risk cancers. We found that the low-risk cancers actually have a very low chance of spreading. Therefore, we can observe them safely. Not that we don't do anything about them, but we watch them closely with regular blood tests and regular MRI. We may, in the end, have to treat them later on, but we may be able to delay the side effects of treatment during the waiting period. Therefore, this is what we call active surveillance. The mainstay of treatment for early prostate cancer remains as a surgery. It's the most established treatment method for prostate cancer, because we remove the prostate in its entirety, and therefore render the patient cancer-free. It remains the best chance of cure. It has the longest follow-up period, and we know that it's very durable. And basically what we do, the surgery during radical prostatectomy, that's what it's called. During radical prostatectomy, we remove the prostate gland, the seminal vesicles, and in the end, we join the bladder back to the urethra, and the patient regains his urinary function. Nowadays, almost all prostatectomies are done with the Da Vinci surgical robot. You may have heard about it. In this procedure, the surgeon sits on the console, as you can see on the bottom right picture, and through that machine, it will control the actual Da Vinci robot, which is connected to the patient. And the good thing about this Da Vinci robot is that it has very precise movements, it is minimally invasive, and is able to preserve urinary as well as sexual function for the patient at the end of the day. Let's see what the Da Vinci robot can do. Let me show you a few videos. So this is how the robot looks like when it is doing its magic. You can see it's very sharp, very fine instruments. It's so fine and so dexterous. It moves almost exactly like a pair of human hands. It can make fine movements, very small movements. And at the end of the day, you can make a beautiful origami bird and almost as good as a pair of human hands. So what is prostatectomy like? Let me show you another video. So this animated video shows you where the prostate gland is, below the bladder, where the urinary flow normally goes through. The structures at the yellow structures at the side indicate the nerve bundles, the blood vessels that supply the prostate. So the nerve bundles, maybe I should explain, is actually what we try to keep because they provide the sexual as well as urinary function for the men. However, we should also aim to remove the prostate cancer completely. Therefore, the challenge during surgery is to preserve as much nerves as we can without leaving prostate cancer behind. And that's where robotic surgery is very useful because it's very precise, it's magnified. We have the surgeon has an excellent three-dimensional view of the surgical field. So as you see in this video, the surgeon tries to push away the nerves and remove the prostate gland. And thereafter, what we do is we hand sew the bladder back to the urine passage, and patient regains his urinary function and his sexual function as well. So that's what surgery for prostate cancer is like. It's called radical prostatectomy. What about for men who are not fit for surgery or have too many medical problems, not fit to undergo major surgery? The alternative to surgery would be radiotherapy. This is basically administering therapeutic doses of radiation to the prostate gland without affecting the rest of the body. It's an outpatient procedure. It has an excellent outcome, almost as good as surgery, and it can be delivered in up to 40 daily doses, depending on the severity and the size of the cancer. Lastly, I'll touch on a few novel treatments that you may have heard of or has come to the medical field in the last 5 to 10 years. All these treatments aim to be minimally invasive, try to avoid side effects, and also preserve the patient's sexual and urinary functions as much as possible. You may have heard of proton beam therapy. It's actually arrived in Singapore in the last 1 or 2 years. Another method would be administering a high-intensity dose of ultrasound to the prostate gland and destroying a part of the prostate that contains the cancer. Another way we can destroy a specific part of the prostate gland is using cryotherapy, which is basically using ice, a small ice ball, and destroying the part of the prostate gland that contains the prostate cancer. And these are all very novel techniques. It has good early outcomes, and the results are very promising. So in a nutshell, I've come to the end of my talk on early detection and treatment of prostate cancer. Through these few slides, I really hope to drive across the message that prostate cancer is increasing in Singapore. And it's not the end of the world. It's not a death sentence, definitely. And what I hope to pass on is that we should have men that come forward to get themselves tested as early as possible, because the earlier you are detected, the better your recovery, the better the chance of survival. And treatment has excellent cure rates when it's performed in the early stages. So next, I'm very excited about the next part of our program this evening. We have a very special guest. His name is Mr. Tan Tai Jong. He's actually better known as TJ. He's very well known among the prostate cancer survivors. He himself is a prostate cancer survivor himself. And without further ado, let's bring on TJ. How are you, TJ?
Hi, everybody.
How are you?
Dr. I'm fine. Thank you, Dr. Pung, for inviting me to this broadcast.
Welcome.
I hope I can share some of my experience to the listeners.
Yes, of course. So, TJ, you are a prostate cancer survivor yourself. So,
Yes.
would you like to tell us about your journey?
Yes, my journey started in March 2009.
Okay.
My father died of prostate cancer complications.
Oh,
So my sister-in-law, who was a retired staff nurse,
yes.
prompted me to go for the PSA test,
Mm.
the blood test that you mentioned earlier
Yes.
on.
Yes.
The result was 14.6.
Oh, it's quite high.
Yes, against the standard of normally a 0 to 4.
Yes, that's right.
Right. And at that time I didn't have any symptoms, and everything seemed to be okay. So something got to be done.
Mm-hmm.
So for treatment, I opted radiation therapy of external beams and brachy, with also hormone therapy.
So, what were your challenges from the time of diagnosis and undergoing treatment? What were the challenges that you faced?
For the first challenge is, what is prostate cancer?
Okay.
I have to go and read it up. I have to ask the doctors, ask the nurses. And then number two, once I understand that, and there are a host of treatment, as you mentioned earlier on.
Yeah.
So I have to choose which treatment that I have to pick. And before that, I have to find out what are the likely or possible risks and side effects of each treatment, so that I can select a treatment which is appropriate for myself. Well, once I have made my treatment choices, I was more at ease and carry on life as per normal.
So at this point of time, again, I would like to encourage all of you to who are online with us to share the link, because we have TJ online with us now. It's very rare to have a cancer survivor going live with us to share his experience. And if there are any cancer survivors out there, do log in, and we have a Q&A later with TJ, and ask all the questions that you need, that you would like him to share, and perhaps even share your own experience. So what kept you going during this tough journey? If you have treatment and diagnosis, what kept you going?
Well, to keep myself going, I have to have a positive mindset.
That's right.
You got to look forward. What is behind you, you can't change. So don't wallow in self-pity and negativity and ask yourself, why me? And when I'm going to die? These things should be put aside. Don't bother with it.
That's great. So what did you learn throughout the whole journey?
Okay, the first thing which is very important, which I would like to share with all the viewers, is there must be a good understanding and relationship between patient and doctor. They must work as a team. If you feel that your doctor is not doing things which for you, for you, but for his own wallet, then you better go and change a doctor.
That's right. Agreed. Absolutely.
And number two, as Dr. Peng has mentioned earlier, the earlier you get your cancer detected, you have more choices, and your outcome would definitely be very, very good. If you are detected later and it becomes stage 4 and whatnot, as Dr. Peng has mentioned, it's more complicated and it will cost you a lot of money. Right? And you're going to suffer, you're going to have pain.
Yeah.
And how to detect early? There are so many things that you can. You go for first thing. Go for the regular health screening.
Yes.
Especially if you are working now and you are having a company paying for it.
Okay.
Don't skip your health screening.
Yep.
Go for your PSA test.
Good.
And if you have any urinary problem, go and see a doctor. Right? So that would be what I would advise listeners.
Okay, so there may be some prostate cancer survivors in the audience with us. So what sincere advice would you have for them? Would you like to share any tricks, anything that you have learned?
Well, we all must understand that when a person is struck with a disease which can be fatal, you will obviously feel anxious, helpless, and even lonely. This depressive mood will not be helpful to your treatment and to your recovery. And to living a life fully and meaningfully. Well, you can take comfort that you are not walking this journey alone. There are many people who are willing and able to help you along the way. Some years ago, I have developed a healing pyramid, which over the years I shared with newly diagnosed prostate cancer patients. When I met up with them as a patient ambassador from the Walnut Warriors.
Yes.
So I will now share with you the healing pyramid.
Okay, let's see what is this healing pyramid.
The diagram is now posted on the screen. You will notice that this pyramid has got 3 sections. The blue one on the top, the green one in the middle, and the orange, yellow at the bottom. The blue one at the top, at the apex, is the patient himself. The patient himself must want to get healed. He must want to get better. If he doesn't want to get better, he doesn't want to get healed, and he's depressed, then it's game over. Nothing can be done. And what must he do? Physically, he must have continue his exercise if he's a guy who is active, and he must sleep well, and he must go about doing the things that he would normally do. Don't just sleep at home and then feel sorry for yourself. On the mental side, you must persevere that I want to get well. I must be optimistic. I must be disciplined if I'm to get well. I cannot do things as I like. I must do things according to the advice of doctors. So I must be motivated to get well. So that would be your mental situation. And number 3, nutrition. You don't eat rubbish all the time. You can eat it. You can take char kway teow once every 2 months. That's all right. So you have proper diet. You change your eating habits if you must. If you have plenty of supper, you always take supper in large quantity. Forget about it, right? And then eat less or have less sugar, less oil, less salt, things like that. Then the second group of people who can help you, which I call the private circle, the one in green. Who are these people? These are the people who are close to you, your family members, your extended family members, your good friends. How can they help you? They can help you financially by helping you with your living expenses if you are really in trouble, or they can even help you with medical expenses if you're really in trouble. And they can give you emotional support, positive emotional support. They can give you, talk to you encouragingly, and then they can help you to walk around and talk and go and see places, and then make sure that your living environment is comfortable, and then go out, interact socially. And they can even help you physically by running errands for you, or help you with the household chores, or even provide you transportation to send you to hospital or to any places that you want to go. And the third group, which I call the concerned community, this is a big group, right? The concerned community would be the hospitals, the support groups, the government organization, NGOs, and even the public. In terms of finance, there are discounts, subsidies, grants, or even donations. You can go to the Singapore Cancer Society. If you are in financial trouble, they can also look into it and see how they can help you. And they are motivational ideas and things that they can do to help you recover or heal better. For example, in Singapore Cancer Society, we have an exercise group. We have a group that walks around Botanic Garden every week, and we interact with coffee session, lunch, and then we listen to talks, just like Dr. Pung has just done, so that we understand better what are the treatments available to us. Then join the support group, come to meetings, then join the national campaigns, or you can even volunteer yourself in hospitals. So all these things take your mind away from your illness. And lastly, the medical fraternity can help you tremendously. As Dr. Pung has just said earlier on, they give you medical advice, they help you to select treatments, and then the nurses and the support group members can share their experiences with you. And last but not least, you get yourself updated with the latest treatment. When I was in 2009, my treatment were limited. Now there are much, much more and better treatments that you can avail yourself. Thank you.
That is awesome, TJ. In one slide, you have summarized everything, and you made this slide all by yourself. Now everyone knows why you are active in the Walnut Warriors. It's an awesome, I'm looking at the comments, and everyone thinks that your healing pyramid diagram is great. You better get it copyrighted and patented straight away.
Well, who do I sell it to?
I see Mike has joined us. Mike is another Walnut Warrior whom you know very well. Hello, Mike.
Yes. Hello, Mike. Mike, good to see you.
All right. So at this point of time, we will have a few questions for TJ, if there are. Let's see. So maybe I would like to ask you, TJ, how do you actually share the healing pyramid during your talks or with your sessions with the Walnut Warriors?
I normally share this with the people, prostate cancer ambassador. So there is a one-to-one. Because I have come across people who are so depressed. When you go and see them, they say, I just don't want to listen to anything. I just want to die.
How sad.
How sad, right?
I see. So Rachel here says that what a motivated patient. Thumbs up, thumbs up. How do you keep yourself motivated?
Well, what happened to me, I can't change.
Yeah.
But what I can do is to help others. So I'm sharing this with on this broadcast is because there are so many people who may be diagnosed with prostate cancer, and they think that it will be the end of the world for them. But don't be discouraged. There are many people who are able to help you.
Yeah.
Singapore Cancer Society, Walnut Warriors, will be one of the first people whom you can turn to.
So maybe, yeah. So yes, Chung Guan is here with us. He asked, which stage of cancer are you, TJ?
Well, when I was diagnosed, I was what they call at a stage 3. And my prostate, my tumor was just about to break out of the prostate. So we got it with the help of the doctors, got it arrested in time. So after about now almost 10 years, my PSA reading is excellent. I'm now at 0.05.
That's great, excellent. So another question for you from Suraj. What kind of follow-up do you need now?
I used to have a 6-monthly PSA test, and last year my doctor was saying that my reading was quite boring because you only get 0.6, 0.5, 0.7. He said, you don't have to see me every year now, every 6 months.
Congratulations.
He said, come and see me every year. My next appointment is in July this year.
Yeah, so another question from Jean. How do you stay positive when at the point when you were diagnosed with prostate cancer? A lot of patients, when I break these bad news to them, you can see that they are immediately devastated. How do you stay positive at that point of time?
Well, at that time when I was told, I got 14.6, as I mentioned earlier on, PSA reading. My whole world almost collapsed.
Yeah, I see that in a lot of patients. Yeah.
And they say first, but when I went back, I told the doctor, "Can I see you again next week?" So I went back and did some research and read about prostate cancer, blah blah blah, and then I thought through. You have to accept reality. You have to accept the actual condition. What you have cannot be changed. You can only move forward. So, do or die, you just move forward and be positive.
Yes, and you turn out so well now.
Yes, thank God.
So Gregory has one question for you. What would you say to someone who is healthy but don't think that he's got prostate cancer and no family history? You know, a lot of men are like that. So thank you for your question, Greg. What do you say to these men who are healthy but no family history?
Well, I would say, as I think Dr. Peng will agree with me, if you are about 40, Dr. Peng would say maybe 50, I would say even 45. Go for your regular screening. If everything turns out okay, okay, you celebrate with your friends. Go for a beer. Go have a good dinner, have a good lunch. But if you turn out something which is about you think not so good, talk to your doctor. They are there to help you.
Yes. Wow, you have really answered these questions very well, and I'm sure all our audience who have been with us enjoyed your session with us. Again, your healing pyramid is very impressive. I hope to hear you share with the Walnut Warriors and more patients that who may need some kind of encouragement and support from you.
Well, Dr. Peng, you can use it as you like.
I will. Definitely, I will. So thank you. Have a good evening, TJ. Thank you for joining us again. Bye-bye.
Thank you very much. Thank you, everybody. Thank you. Bye.
Okay, so that was TJ, an amazing gentleman, still so positive, still so encouraging despite all these years. He is still very active in the Walnut Warriors. Okay, so let's come back to prostate cancer, and hopefully if the time we have left, let's take some questions. Let's see, can we? So Olivia asked, any correlation in patients with heart stents and with diabetes that they may have cancer at an earlier stage? So I do not know of any evidence that actually say that patients with heart disease or diabetes have a direct effect on being, of getting cancer more. If anything, it could be due to indirect causes like unhealthy diet, westernized diet, like I mentioned, diet that is high in processed foods or high in grilling, high heat. These may have indirect influence of causing prostate cancer. So another question from Suni. This sounds like a clinical problem. MRI shows a lesion of 8 millimeter and 1 cm, and it's called PIRETS 4 and 5. What's the chance of that being cancerous? So for the audience, the word PIRETS is a grading system that we use to grade how suspicious a lesion looks like on the MRI. The highest grade is 5, the lowest is 1. In general, 1 and 2, they are what we call benign, we don't think that that's prostate cancer. 4 and 5, we are more suspicious. So in a study which I did last year, which was published of about almost 50 men in Singapore who did the MRI, and we biopsied them, up to 50% of patients with PIRETS 4 and 5 were found to have prostate cancer. Therefore, I would personally recommend all men with PIRETS 4 and 5 to undergo MRI targeted biopsies like I've shown just now in the slides. So thank you, Jung Guan, for your question. You asked besides HT and RT, HT means hormone therapy, RT is radiotherapy. Besides hormone therapy and radiotherapy, what treatment is available for stage 4 cancer? So Jung Guan, you are absolutely right. Hormone therapy and radiotherapy are the standard of care for stage 4 cancer. Stage 4 cancer means the cancer has already spread to the other parts of the body. Most commonly, the prostate cancer spreads to the bones first. The good news is there's a lot of alternatives. There are a lot of alternatives to treating stage 4 prostate cancer. We have special radiation emitters that target bones, what we call alpha emitters. They target bones and go direct to the cancer cells, bones which contain cancer cells. That's a form of targeted radiation therapy. And in the last 4 to 5 years, we have at least 3 to 4 new oral chemotherapeutic agents which have very low side effects. Drugs such as Zytiga, drugs such as enzalutamide, they all have very good results and can significantly prolong survival for these stage 4 prostate cancer patients. RK, how are you? I hope you are well after as I did my hernia, is that okay to lift the heavy weight again? Okay, so that is related to the surgery. Yes, it's very long since the surgery, about a year now. You are good to go. Do your gym weights again. Maybe I can relate that back to prostate cancer again. So weightlifting, in general, weight loading exercises for the muscles, for the skeleton, is a very good way of strengthening your bones, especially in patients undergoing treatment for stage 4 prostate cancer. I routinely refer my patients with stage 4 cancer to actually specialized gym exercises, because they will load up their muscle mass, load up the bones, and therefore strengthen the bones. It avoids the side effects of osteoporosis, which is caused by the treatment of stage 4 cancer. All right, the questions are coming in hard and fast. So let's take one last question for Richard Chua. What level of PSA should I be of concern? All right, so this is the question. As actually TJ alluded to just now, in general, we take the cutoff of 4 as what we would, when we recommend a prostate biopsy. Of course, there's no black and white in this area. It's a different shades of gray. The older the younger you are, the lower the cutoff we would use. So in general, for a man in the 50, in Singapore man in the 50, we will use 4. If you are slightly older, for example, if you are in your 30s or your 40s and you have, your PSA should be even lower than that. So we may use a lower cutoff, for example, 3.5 or even 3. So any normal PSA in men without any suspicion of prostate cancer is usually in the range of 1 or 2 or even lower. So in general, most of us use a cutoff of 4 or 3, around there. So another question, maybe we'll take one last question. It caught my eye, which asked me, how did I end up becoming a urologist? So I like to, so if I wasn't a urologist, I would have been a plumber. But yes, so a urologist basically does what is in charge of the urinary system of the men and also in the women. And the thing that caught me about urology is because it combines both surgery, which I love doing since I'm a surgeon, as well as medical treatment using medication, using medicines. For example, stage 4 prostate cancer, we don't usually operate on them, but we do give chemotherapy agents on them. And even simple prostate enlargement, many men do not need surgery, but we just simply prescribe medication and they get symptom-free. So it's this combination of using both medication and surgery at the right time for the right patient that attracted me to this specialty. So thank you everyone for your questions. I really enjoyed answering them, and I believe TJ also enjoyed his session with you. So at the end of the day, at the end of this evening, a few messages I would like to get through. Firstly, get yourself tested. If you are above 50, if you have urinary symptoms, please exclude prostate cancer so that we can detect it early if we can. And the way, if you are considering getting yourself tested, please get in touch with your nearest healthcare professional, be it in your polyclinic, your GP, or your nearest urologist, and contact us if necessary. And we look forward to hearing from you and hopefully do away with stage 4 prostate cancer in a few years, and we all detect them early. So once again, thank you. At this point of time, maybe I'll like to welcome you back in 2 weeks' time on the 29th of May when we have the 3rd installment of What's Up Doc with FeM Surgery. Again, we have 2 special guests. We have a dietitian and a physiotherapist. and you'll find out how these two professionals can help you with your urological problems. So until then, it's been a pleasure to be here this evening. I hope you enjoyed it as much as I did. So stay safe, stay home, and good night. Bye-bye.